I've already added patient serum, so add patient serum, step 1. Okay, step 2 for the for the phosphate test. Remember that you had 2 bottles of reagents. You have phosphate test solution 1 and phosphate test solution 2. Similarly with the calcium test, you have calcium test solution 1, calcium test solution 2. Remember not to mix them up, because if you put solution 2 in before solution 1, it will not work. Okay? So just a little extra attention on your exam day. I know it's difficult, but it'll pay off, I promise. For your phosphate test, remember that you get an appendix on your exam, and any one of you want to see the appendix so that you know that you can use it before your exam, please just ask. I will show it to you, and it will tell you 3 drops of solution 1 for the phosphate test. So add 3 drops directly into the liquid, and yes, unfortunately, if you add 4, it will not work. If you add 2, it will not work. 3. It's the only time where counting matters. Okay? Then 3 drops of phosphate test solution 2. Remember, this is the really, really sticky one, so you want to aim it directly into the middle of the solution, because if you drip it along the sides of the test tubes, it'll never reach the bottom, in which case it doesn't count as a drop, and again, it will not work. So aim it directly into the middle of the solution with shaky exam hands, and 3 drops. 1, 2, 3. Give it a quick little mix, and this one you want to look at the color usually within the first minute or so. If you look at it 5 minutes later, there's usually no harm, no foul, but if you leave it for a good 15-20 minutes before you decide to look at it, the color will have completely changed and you're going to have to do it again. Then you just compare your color to your test card. So in this case, it's green. We'd probably read it as 1.1, maybe 1.5. And if you look at the appendix of normal values that we give you, yes, you will get the appendix of normal values. We don't expect you to memorize them. It'll tell you that's normal range. Someone want to hold this for me? For your calcium test, your appendix says solution 1, 5 drops. So that's what you're going to do. Calcium test solution 1, 5 drops. 1, 2, 3, 4, 5. And then you add solution 2 drop-wise until it turns blue. So it's rather clear right now. So you're just going to add this 1 drop at a time until it turns blue. 1, give it a shake. Is it blue yet? So 2, give it a shake. 3, I'd say that's got our blue tinge, and compare it usually to a white piece of paper, so we'd record this as 3 drops. And again, if we use our appendix in the table of how many drops means a normal result, 3 tells us normal, I believe. Okay? That's how you do your phosphate and calcium test. The glucose test should be something you guys are all similar to. Add the reagent, it tells you to water bath it, so water bath it, and then use your glucose color card to determine your serum value. Alright? And no spec on the exam. You wouldn't have to use the spec on the exam, but there's nothing saying that I couldn't give you the graph and some absorbance readings and expect you to extrapolate much like you did in the lab. Okay? That's all.